Serving 900,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawazadanuk people of Kincombe Inlet to Victoria, from Tofino to Comox. It is our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-chah-nulth cultural families. We acknowledge our commitment to truth and reconciliation with First Nations, Métis, and Inuit people. The Island Health family includes 30,000 healthcare professionals and 1,500 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 287 sites and facilities with more than 5,800 long-term care beds, over 1,200 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $4.2 billion. Each year, this funding supports 474,000 visits to emergency departments, 73,000 surgeries, more than 61,000 MRIs, 175,000 CT scans, more than 165,000 visits to urgent and primary care centers, 506,000 professional service visits, 60,000 adult daycare visits, and 3.7 million hours of home support. Island Health has expanded our primary care services with same-day access to primary care at 3 urgent care clinics, 7 urgent and primary care centers, 2 community primary care clinics, and 1 after-hours primary care clinic. Under the leadership of 8 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments each year. From before birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
Good evening, everybody. Nice to see you here. I'm Leah Hollins, the Chair of the Board of Directors of Island Health, and on behalf of my colleagues, welcome to our public forum. Whether you're joining us here in person at the Burnside Gorge Community Centre in Victoria or online through our live stream. Before we get underway, I acknowledge and pay respect to the Lekwungen peoples of the Songhees and Esquimalt First Nations, whose territory we are meeting on this evening. I'm very grateful to introduce Diane Sam. Diane is a Songhees Nation community member. She has devoted much of her time to working in the education field as a First Nations education assistant. Diane has been an avid Lekwungen learner and is very eager to keep learning. She is the former team leader of the Songhees Cultural Center and feels that working at the center sparked a light in her digging into her culture and language of her homelands. She is passionate about sharing information about the territory when the opportunity arises. Diane is currently the Community Engagement Manager at the First People's House at the University of Victoria, and I'd like to welcome Diane to the podium.
O Sam Nishtelicha, Haichko Gonzano Techa Lukongan Tunuth, Swilak E to Pothiksa, Thunisne, Chitzelays and Lukongan E Houset, Helix and Quinzaneatha, Iquanis Konanga Hela, Thana Main La, Frank Sam, Thana Tain, Helena Sam, Thana Nanana. Say your name. Go ahead.
My name is Zoa.
Good evening, everybody. I just introduced myself as Sawila Kintupathiksa, and those two names come from a Hausit, and from my late Grandma Sarah and from my late Grandpa Pally from Songhees. It's really important for me to share those names and where they come from. In case I have family in the room, which I do, I'm just acknowledging my family, Tanya, in the room. My daughter is from Kinkum Inlet, has family ties to Tanya, so it's really important to acknowledge that. My late dad is Frank Sam, my late mom is Helena, and my children are Amy, Danica, and Thomas, and it's really good to see everybody here today. Lekwungen translated means place is smoked herring, home of the Songhees and the Esquimalt people. And historically, protocol this is not a new thing. I know that the TRC made calls to action for protocol, and a lot of our protocol took place in the harbor, right in downtown Victoria. And I'm really honored to be here. I always say that I'm not doing these welcomes on behalf of me, but they're on behalf of my family and my community, our leadership, but more importantly, our ancestors. Haichka for allowing me to be here and opening your work up in a good way.
Ashka.
Want to grab this and say thank you? Thank you.
Thank you, Diane. We really appreciate you being here today, and I'm very grateful for you welcoming us as visitors to live, work, and care within your traditional unceded lands. I also recognize the Inuit, the away-from-home urban Indigenous people, and the Métis Nation of Greater Victoria's chartered community who choose to call these territories home. We do this to reaffirm our commitment and responsibility to improving relationships between nations and cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done as the cultural genocide, the assimilation of Indigenous people, the residential school system, and discovery of graves of Indigenous children who attended them, the too many missing and murdered Indigenous women and children, and the social inequalities and racism that exist today. I invite you to think about the responsibility we have to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility, and we demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and the ongoing impacts of colonialism. Public forums like this allow the board to meet people and communities in the communities we serve. They are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former nurse, a Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what I am doing right for the patient? Caring for patients is why I started working in healthcare. And caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. And now it's my pleasure to introduce you to our board of directors, who are responsible for Island Health's overall direction. In addition to myself, the board includes Ron Rice, a member of Cowichan Tribes who lives in Victoria, Ron Matson from View Royal, Harold Cull from Colwood, Diane Brennan from Nanaimo, and Ann Davis from the Comox Valley. Unfortunately, 3 of our board members, Ann McFarland from Victoria, Shawnee Cassavant from Hupetchesset and Sayshot First Nations, and Andy Adams from Campbell River could not be here tonight. Our local leadership and executive management team members are also joining us. You will hear from some of them later this evening. We do have a full program today, and we have our new medical health officer, Dr. Christina Kay, who will speak about regional public health and wellness. We'll then have a presentation from Mental Health Recovery Partners. And the last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions by email in advance. I will open the floor to questions so the board can hear from you. But first, I invite Island Health's President and CEO, Kathy MacNeil, who will provide an update on health and care service delivery across Vancouver Island and Victoria.
Thank you, Leah. And I just saw Diane leaving us and just wanted to express my gratitude for her warm welcome and her teachings this evening. I also want to acknowledge and pay respect to the territories of the Lekwungen peoples of the Songhees and Esquimalt First Nations. And it's our privilege at Island Health to provide health and care on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-Chulnith cultural families, and also to serve Inuit away from home, urban Indigenous people, and the Métis chartered communities across Vancouver Island. Before I get started, I just feel like I need to, this is not what I normally sound like. I'm just recovering from some pneumonia. I'm no longer infectious nor contagious, as our board chair tells me that there's two things. But I may start coughing, and I may have to pitch over to my friend Marco if I can't get my coughing under control. So just don't want you to worry about your safety here, but just wanted to let you know what was happening. So given the busy time of year that we're heading into, I really want to thank the people who are here, both in person and online, for expressing your interest and your commitment to your health and care here in Victoria. We know these are challenging times for people and communities. Many residents in Victoria face issues like the rising cost of living, housing security, rewarding and meaningful social connections, isolation and loneliness, and timely access to health care. In particular, these challenges are impacting the most vulnerable in our community: seniors, young families, and those who are unhoused or struggling with mental health and substance use. These are multi-layered, complex problems that require partnerships across agencies, organizations, and the community itself. At Island Health, we're privileged to work closely with community partners to deliver health care. Despite the challenges we experience, I'm uplifted by the resilience and determination of those people who are working in our community and the healthcare workers who've come together to respond to these issues. I want to take a couple of minutes now just to talk about what I'm hearing from them, including access to primary care, surgery and diagnostic services, homelessness, and the impact of untreated mental health and substance use. The care provided by a family physician or nurse practitioner in the community is a challenge across our country, and we're not immune to that challenge here on Vancouver Island. Here on the southern part of Vancouver Island, more than 110,000 people do not have a primary care provider. That's for MRIs and CT scans. You saw some of that in the video.